So when I come to the United States on the 1990s, so my supervisor, Professor Snell came. So Dr. Yu, if you can improve this therapy, maybe you get the Nobel Prize. Well, no, don't need. Maybe if you increase my salary, I'm happy, you know. You know, that is very poor, everybody. You know, Chinese government supported the fellowship to American only $500 per month. But Dr. Kim gave me the $1,200 per month. It's good enough. But after I studied the idea, second month, he gave me the $24,000 per month. So that already gave me, awarded me already, only the idea, you know. So the idea is, so oil not good, solid not good. If we how about the water soluble drug, but have to have the slow release functions. Because the water drug you put in the tumor very easy to distribute well. But if no slow release, he go whole body right away. Okay, must be water soluble, distribution even, but have to keep it inside forever, longer. That's a big question. I take almost 10 years to really figure out how can I do that. But the Snell Kim don't have the patience. After 2 years, you know, he don't have the patience. No, you stop it. What do you think we can reach this goal? Well, okay, you are boss. So I left him. I went to the Salk Institute. Everyone knows Salk, S-A-L-K. They have the 8 Nobel Prize winners in that small institute. My big boss is Renando Beneco. He get a Nobel Prize in 1978. My young boss is really boss, close boss, is very good too. Now working in the Johns Hopkins. So we do a lot of the basic research, cells, DNA, RNA, culture, animal model. We do all this, but I didn't forget what I should get my goal. I learning the basic research. I don't want to become a molecular biologist. I don't want to be famous on the molecular biology. I want to do something work for my patients. I need the clinical work first. We cannot wait. Patients die every day, any moment. So finally, I get a grant by the Army in 1994. My boss, Sarah Sukuma, need to move to the Johns Hopkins because to get the improvement, get the associate professor. But after he left, he want to carry me, go to Johns Hopkins. Well, no, I don't want to go. No, it's enough. I know the basic research enough. I need to do something else. But I have a grant, the UCLA, and give me the position assistant professor. So I get a pretty freedom time. I need to think what I should do. So I'm very happy. I didn't study for PhD in American. I did my own. If I studied the PhD in American, I will become a molecular biologist, maybe the immunologist, you know, because very deep, very narrow. You never can work with patients. So I have all the structures. I want to put together how to work in the patients. After working at the UCD as a professor, assistant, so I have more time to thinking. So like in my picture, you are like this. I want to think a lot. But I know the American lab doesn't work for me. Because only animal, only cell culture, not good. I need the patients. I need the hospital to work with me. But you know, we are Chinese. I don't have license MD in American. I don't have a chance to touch the patients. But I'm fully MD in American, in China. I need to come back. I need to set up my own hospital. I need to try my idea. So I studied in 1995, 6. I come back to China to talk a lot of hospital. And in Beijing, I used to work in the China-Japan Friendly Hospital. It was a big hospital. And Peking Unit Hospital too. I talk with them. Don't look like I have hope. They don't want to give me freedom. They want to give me the position. Or you become the oncologist to chemo. Or you can do the radiation oncology, you do the radiotherapy. Or you can do the nuclear medicine. But nobody give me the really comprehensive, integrative department to do all together. Not good. Need to open my own hospital. So what I have to do? I don't have much money, because every year only, not that much money left after you spend the money for research for the family, So I meet one of the friends, Josie. in San Diego. It is very close to my friend. He's a cancer survivor. After talking with, we worked together for practice Qigong over years that time already. So Dr. Yu, I support you. How much money you need? Well, I don't need much. Only less, $100,000 enough. Okay, I borrow you. He signed the contract and borrowed me money. So I bring that money because I'm very freedom in the professor. I can every year I have a couple months of freedom. I go back to China. I go to my village, close, poor area, much poor area than all around here. Not much people. Even about 3 miles to the city. The land very cheap, only maybe less $500 acre. Okay, I buy 10-acre land. I build my hospital. I tried my idea. Oh, works. Fundamentally works. I'm so happy. Okay, next one. See? So all the world, they want to try the intratumoral chemotherapy, but unfortunately, any drug you injection, and a couple minutes later, he flow out. So this is my way. This is my way. Next one. So I label the isotope. You inject it into tumor, you can see the drug leak the right way. After 24 hours, all gone. See, mine is still there because isotope decayed, half-life is gone, but still there. See, after you counted the drug over 100 times almost higher than control groups. So my way put it into the tumor on the high concentration and enough time, long time. Okay, next one. Oh, I'm sorry, this is in Chinese a little bit. So this is the new concept. What new concept? So autologous tumor matrix as the drug carrier for slow release and the autologous vaccine. I get the patient on 2004. So all my idea I tried works. So we inject the drugs, the drug chemical immediately take the function for the chemical surgery. The drug killed the tumor right away, surgery. But tumor died, debug, cannot remove to the whole body. But the drug insert into the each cells. The drug will continue to kill tumor, and they modify the tumor, become the vaccine. Everybody know, we have the body, have the immune system against the cancer. But when you get the cancer, your body, immune system cannot figure out who is the enemy, who is the cancer cells. But when tumor died, he released antigen. The antigen not very strong. We put one the modifier to modify your tumor antigen, get it stronger. Amplify the tumor antigen, can let your body to recognize who is the tumor cells. We did a lot of research on this. It works. Next one, please. So everybody know the chemotherapy we have to use in commonly. No other therapy. Surgery, radiation, chemo, not much choice. But however, if you give it the chemotherapy, you have to lose your immune system. It's not good. Everybody know, patient know, doctor know, but no choice. I only do chemo, sorry. But very recently, they found it. If you give one-time chemotherapy, only one, your body immune system maybe temporarily go up because the chemotherapy kill your tumor cells. The tumor cells died, release a little bit of antigen to your whole bodies. By the way, the chemotherapy kill your lymph cells. The cells need replicating again. At this time, the antigen maybe stimulates your bone marrow or lymph cells to produce a little bit stronger tumor-specific antigen. We call the tumor-specific T cells or antibodies. But unfortunately, in the world, not only in China, keep continuously chemotherapy. Twice a week for 4 weeks, 6 weeks. Get rest, continue chemo. Any your body build up the specific to cancer, kill again. So cannot this continuous chemotherapy never can really build up your body immune system. Because he continue to kill your immune system. Even your first time chemotherapy boosts up immune system up. He continue to kill. It's not good. But very recently, we found this. Next one.